Why is the hip joint prone to degeneration? Prevention tips everyone needs to know. Hip osteoarthritis is one of the consequences of the aging process. Although not a common disease, hip osteoarthritis is considered a serious condition. The disease often progresses silently, is difficult to detect in the early stages and if not treated promptly. Structure and function of the hip joint. Structurally, the hip joint is made up of two main parts. The femoral head is spherical. The acetabulum of the pelvis is concave. The acetabulum is covered by a layer of fibrous cartilage, which helps protect the joint and maintain the amount of lubricating fluid. This is the connection point between the femur and the pelvis, playing the role of supporting the body and performing basic movements such as bending, stretching, or rotating the body. When the hip joint is weakened by degeneration, these functions are gradually lost, causing difficulty in daily activities and seriously affecting the quality of life. What is hip osteoarthritis? The main cause of hip osteoarthritis is the wear and tear of the cartilage that protects the joint over time, leading to prolonged pain and reduced mobility. Without early intervention, the disease can cause deformities of the joint structure. Who is at risk? Hip osteoarthritis can occur in anyone, but some groups are more susceptible to the disease, including elderly people, people who have had trauma or accidents in the hip joint area, people with a history of hip arthritis, women, higher risk of the disease than men. Causes of hip osteoarthritis. In addition to aging, the disease can also originate from many different causes, such as congenital malformations of the hip joint, trauma, vigorous physical activity, excessive exercise or participation in sports can cause joint damage, genetics, weight, low birth weight. Premature or underweight babies may be at higher risk of developing small joint defects, which increases the risk of degeneration later in life. Symptoms of hip osteoarthritis. Patients often experience common symptoms such as pain, starting from the groin area, spreading to the buttocks or thighs, increasing with movement. Joint stiffness, often occurs in the morning or after sitting for a long time. Joint dryness, there is a crackling sound or a grinding sensation when moving. Limited mobility, patients have difficulty with activities such as bending, walking, or squatting. Is hip osteoarthritis dangerous? The hip joint is located deep in the body, covered by many layers of tissue and ligaments, making damage in this area difficult to detect. Patients can easily confuse symptoms with other problems such as low back pain or pelvic arthritis, leading to incorrect treatment. The disease can lead to complications such as joint deformity, hip fracture or fracture, muscle atrophy around the hip joint, mental health decline due to prolonged pain. How to treat hip osteoarthritis. 1. Use medication. Mild cases, non-steroidal pain relievers, NSAIDs, help relieve symptoms. Severe cases, use prescription drugs or steroid injections, temporarily, to relieve pain. 2. Surgery. Partial or total hip replacement. Femoral head resurfacing for cases that do not require complete joint replacement. 3. Lifestyle changes. Exercise gently to maintain joint flexibility and strength. Maintain a healthy weight to reduce pressure on the hip joint. Prevent hip osteoarthritis by maintain a healthy weight. Increase exercise. Moderate exercise helps improve musculoskeletal health. Avoid overexertion. Limit habits that put a lot of pressure on the hip joint. Stages of pain and symptoms of hip osteoarthritis. Early stage, pain is mainly concentrated in the groin area, can spread to the buttocks, thighs, or even the knee joint. The pain often increases when the patient moves or stands for a long time. Middle stage, pain is more severe in the morning, especially when changing from sitting to standing or when moving. Late stage, pain occurs at night, even when resting. In particular, changes in the weather also make the symptoms more severe. Other signs of hip osteoarthritis. In addition to pain, patients also experience joint stiffness, often occurs in the morning or after sitting for a long time, which can limit the range of motion of the joint. Dry joints, when moving, the joint makes a crackling or creaking sound. Difficulty in daily activities, simple activities such as walking, bending over or getting into a car also become a big challenge. The danger level of hip osteoarthritis. The disease can cause serious complications such as joint deformity, leading to disability, fracture or fracture of the hip bone, atrophy of muscles and ligaments around the hip joint, affect sleep, causing mental decline, anxiety and depression, increased risk of obesity-related diseases such as high blood pressure and diabetes. How to diagnose hip osteoarthritis. Diagnosing hip osteoarthritis requires a combination of methods. Clinical examination. The doctor will ask about the symptoms, when they appeared, and how they affect the patient's life. Next, the doctor checks for signs such as groin muscle weakness, joint range of motion, and swelling and pain. Imaging tests. X-ray, CT or MRI. Clinical tests, including vascular ultrasound, blood count, blood sugar test, or liver and kidney function indicators to develop an appropriate treatment regimen. Treatment methods for hip osteoarthritis. Medical treatment. Mild cases. Use non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen. However, they should be used as directed to avoid side effects on the stomach and cardiovascular system. Severe cases. Prescription drugs such as duloxetine or tramadol can be used. In addition, injecting steroids into the joint to relieve pain is also a temporary option. Surgery. If medication is not effective or the disease has progressed severely, your doctor may prescribe hip replacement, femoral head resurfacing, lifestyle adjustments, regular gentle exercise to increase joint flexibility, maintain a suitable weight to reduce pressure on the hip joint. Supplement foods that are good for bones and joints, such as green vegetables, fatty fish and nuts. Hip osteoarthritis cannot be completely cured, but proper and timely treatment can help control symptoms, improve quality of life and limit complications. Surgical methods for treating hip osteoarthritis. 1. Hip replacement surgery. This method aims to remove the damaged hip joint and replace it with an artificial joint. There are two types of hip replacement surgery. Partial hip replacement, indicated and the cartilage layer is worn away and the joint is only partially damaged. Total hip replacement, suitable for the following cases. People over 60 years old. Patients with underlying diseases that damage the hip joint, such as rheumatoid arthritis or osteonecrosis. Severe symptoms that greatly affect daily activities, such as prolonged pain, difficulty sleeping, difficulty climbing stairs or standing up from a sitting position. 2. Suprapath hip replacement technique. Suprapath is an innovative method that helps reduce the level of invasiveness in surgery. Instead of cutting the joint capsule and surrounding muscle tissue, this technique only creates a small incision, approaching the joint from above. Advantages. Preserves soft tissues around the joint, reduces postoperative pain. Patients recover faster, can perform daily activities sooner. Note, this method requires high technique, not all doctors can perform it. 3. Femoral head resurfacing. This method does not completely remove the bone head but only covers the damaged surface with metal. Benefits. Reduces friction between the femoral head and the acetabulum of the pelvis, helping to reduce pain. Preserves the femur, allowing the patient to undergo hip replacement in the future if necessary. Changes in lifestyle. Regular exercise. Gentle exercises help maintain joint flexibility, improve blood circulation and reduce the risk of complications such as cardiovascular disease and diabetes. Change posture. Be careful when moving to avoid putting additional pressure on the hip joint. Physical therapy. Improves blood circulation and provides nutrients to the joint. Improves the strength of the muscles around the joint, improving posture and balance. Weight control. Maintain a reasonable body weight to reduce pressure on the hip joint. Diet. Add foods that are good for the joints such as fatty fish, green vegetables, nuts and avoid consuming foods high in sugar, salt or alcohol. Prevention of hip osteoarthritis. While you can't completely prevent it, you can reduce your risk by weight control. Avoid being overweight to reduce stress on your hip joint. Regular exercise. Strengthen the muscles and tissues around your joint to protect against wear and tear. Simple lifestyle changes can help maintain long-term hip health and prevent the disease from progressing rapidly.